So oncology is obviously cancer care, and that's a very emotive subject. We're all scared of getting cancer ourselves, and the incidence of cancer in dogs and cats is the same as people. Roughly 1 in 3 dogs or cats would develop a tumour at some point in their lifetime. It's also an area where people get very worried because we associate cancer treatments with lots and lots of side effects. So veterinary medicine is very different to human medicine in that we want to do what we very can, but we have to make, and I don't mean rude to human doctors, but quality of life matters more than anything else. So we will treat some disease we know we can treat. We will treat and do all we can to keep the quality of life of the patients actually better than they were before they had the tumour. So we do chemotherapy here 2 or 3 times a day, but we're using the same medications that people have, but we're normally using roughly 1/3 of the dose, giving it less often. So we try to get the tumour to go away for as long as possible, but not damage the patient's quality of life. So most dogs and cats don't lose their hair, hopefully they don't get upset tummies and all the things that we worry about and we hear about, and hopefully, sadly, some people have had experience of in their own family. So we try to do that in a very caring way, but we accept at the beginning there's only very few tumours we can cure. Mostly it's about keeping the quality of life good for as long as possible. So it does mean there's some cancers we don't treat because we can't achieve what we want to achieve, but there's an awful lot we can do to keep things away for as long as possible. So it's a funny specialty in some ways because in some ways it's sad, but actually it's a very rewarding thing to do because we can normally help those clients hugely and get the pets to be where we want them to be for as long as possible.